invite Dr. Meenakshi to us. Anu has some important pearls, some myths to burst for you. How to eat right during your pregnancy, while you're preparing for pregnancy, or if you have any infertility issues. Anu, do you want to discuss the secrets with us?
Yeah, sure, definitely. So, everyone know that the main part of your infertility is diet. So, you can correct almost all your problems with the diet itself. So, there are so many food items which will improve your fertility. So, I'm going to discuss a few items here. So, after that, ma'am will give you all the information related with the fertility. So, we'll start. Firstly, the important part of your diet is including all the food items, all the food groups together. That's a very much important thing. Mostly we are seeing that so much of persons doing this low carb diet or only this protein diet. So that is not much recommended. Only balanced diet will give you all the nutrients and you'll get infertility complaints and all these things. So we'll go for the nutrient part. So mainly I'll suggest a Mediterranean diet for the infertility patients. Why? Because Mediterranean diet will help to improve their fertility, and also it include more of green items and green leafy items, green vegetable, all these things will be included in it. And also protein is also very essential in it. You can go for a plant protein. Other than taking this non-veg protein, it's much better option for the infertile persons. So and one more important thing is calcium. That is very important part of your body. So calcium is also will give you more to improve your fertility and all. So very importantly, you have to include dairy products, milk, curd, yogurt, and paneer. All these kind of things you can include in your daily basis, and that is much beneficial for you to improve your fertility. And next thing is while going with the fruit, don't stick to a single fruit. You just try to include all the fruits together, or if you are taking a single fruit, just only that nutrients you will get. To include all the nutrients together, we need to combine all the fruit items. Okay, so don't stick to a single fruit items. Include all the fruit items and all the vegetables together to balance your nutrients. Okay. Then next thing is fat. Fat is very important part of your diet, but if you are going for a bad fat, it will be much unhealthy for you. So don't use bad fat, bad cholesterol, all these things. You can go for a good fat, especially nuts and seed will give you more health benefits, and also it will be much better to improve your fertility also. And you can use this coconut oil and olive oil, vegetable oil, instead of taking some dalda or some other refined oils and all. So that is much better option. Okay. So next is eating a low glycemic index food items is also much better to improve the fertility. So what is low glycemic index food items means? Whenever you are taking some food items, that will digest very easily and quickly it will raise your glucose level in your body. So low glycemic index food items will take more time for the digestion and for the absorption. So the sugar won't shoot up that much faster. So you can go for a low glycemic index food items, especially while you are taking, for example, while you are taking a bread, you can go for a multi-grain bread or a wheat bread. That will give you more health benefits because it's a low glycemic index food. At the same time, if you are going for a maida-based bread, so definitely it is having a high glycemic index. So the next thing is protein. Very, very important part of your diet is protein. You have to take enough of protein in your regular basis. At least 1 gram of kg body weight, you have to make sure that you are getting enough of protein from your daily diets and all. So you can go for plant protein is of two types. You can go for plant proteins, or otherwise you can go for animal proteins. So much better option is plant protein compared to this animal protein. That will give you more proteins, and also that is having much more health benefits also. Okay, so try to include dal items in your diet, and also try to include soya, paneer, and the sprouts, all these kind of things in your diet. That will be much healthier. And also include this fish. That is a very, very important thing which will provide you omega-3 fatty acids. It's a very important part of your fertility diet. So definitely you can include fish weekly twice in your diet. That is also fine for you. And non-veggies you can have twice or thrice in a week. That is enough, not more than that. And don't go for the fried food items, junk food items, especially fast food items. All these will trouble your health and also trouble your digestive systems also. So the next thing is folate. Folate is also one of the important part of your diet. So you can include more green leafy vegetables in your diet to improve your folate content. And also you can include seeds and nuts, all these things to get your folic acid in your daily diet. And the next thing is dairy, very much important. Curd, buttermilk and cheese, all these kind of things can be added in your diet. And don't use tea and coffee. That is will having a like disadvantage, like it will affect your nutrient absorption. So whenever we are consuming a tea, coffee, it will affect your body negatively. So don't try.
Without beating around the bush, I'll come straight to the point, ma'am. The first and basic point which the patients would like to know is, how does pregnancy happens? So they have so many myths about it. What days, what happens inside the uterus. So if you can just explain to our viewers, how does this happen?
So thank you, Dr. BHARTI, for giving me this wonderful opportunity. So how does a normal pregnancy usually happens is, when actually a sperm and the egg join together, it actually forms into a healthy embryo. So how does this happen? Usually when a female gets her periods, that is the start of the menstrual cycle. That is a day 1 of her cycle. So generally on the 14th day, it takes 14 days for an egg to get developed, and the eggs are getting released from the ovary. It gets deposited behind the uterus. From there, the fallopian tube or the reproductive tube, which is actually will be there behind the uterus, will collect the egg, and it will be ready for the sperm to come and meet with the egg. So the sperm, when they have a sexual intercourse, usually what we suggest is, anytime after their periods, we ask them to have the contact every 3 days once. So when the sperm at that time enters inside the uterus, it is available to fertilize with the egg for about 48 to 72 hours. So the sperm, by wagging its tail, it will be able to enter inside the uterus and reach the fallopian tube. So there the fallopian tube will be taking the egg and it will be keeping it ready for it. So the sperm and egg will join at the part of the fallopian tube and will form into a healthy embryo. Now around 6 days from its formation, the fallopian tube will move like a wave and it will slowly bring the embryo inside the uterus, and then inside the uterus the lining will be ready to take up the embryo. So once it gets attached, the blood supply starts for the embryo and a healthy baby starts to develop over a period of 9 months.
Yeah. So see how this is how it works. And if everything is normal, everything is perfect, 4 to 6% chances every month that you might become pregnant. So going to the next question, a very important question for this age. What is the right age for the couple to plan a pregnancy?
Yeah, so this is a very much needed question of the time.
Yes.
So what is the right age means, usually we suggest to have a conception as early as possible in their life. Meaning less than 35 years itself, try to finish their pregnancy. So that is a maximum easy age to get conceived.
Right.
Now the minimum age we usually say at least after 21 years, because after that only they will also be able to understand how to take care of their health, how to take care of their body, and how to take care of their pregnancy and the baby as well. So usually we say after 21 years, and maximum try to finish it by 35 years so that we don't have any complications during their pregnancy as well. Yes.
Yeah. So for the viewers, you would have heard so many stories at 40, at 45 people conceiving. They are stories because they are rare. Please try your conception when you are mentally ready within the age limits as doctor has told. So the next question, when should a couple seek help from the doctor?
So once they are actually married for a period of 1 year and their age is less, say less than 35 years, they having a good sexual contact, they have no other issues, then for a period of 1 year they can try their normal way of conceiving. In spite of having a good sexual contact but still they are not able to conceive, then they can meet a general gynecologist. This is for 1 year. Suppose the periods are irregular, or the male partner knows that he had some surgeries in his childhood, like when his testis has not come down and for that he got operated, etc. So they can try for 6 months, and if it doesn't happen, again they can meet a general gynecologist. Or if the female age is more than 35 years, try to meet up after 6 months if they are not able to conceive, a general gynecologist.
Yeah. So, being a general gynecologist myself, I have seen so many patients, 3 years, 4 years, trying but having an obvious problem with them and not addressing it. So they come, just correct this, just correct that. It doesn't work that way. It comes as a package. If you have irregular periods, get that sorted and get your pregnancy sorted. Both are going to happen together. So that point is very valid. What comes in your mind when a couple comes for consultation to your clinic? Because they already have so many YouTube videos at the back of their mind.
Yeah.
Already very anxious.
Yes, definitely. So when a couple is coming to meet me, most of the time they must have reached to many other people before coming to me.
Yes.
So as you said, they will have a list of questions to ask to me. Most of the time we can actually see that they are taking multiple opinions and they mostly will be stressed.
Yes.
That's
very
the first thing when I see the couple, that's what comes into my mind. So I talk to them. I first the relationship will not be correct. So we try to sort that problem first, because they'll be married for 3 years, 4 years, but they will not have any good relationship. Because of that, they will not be able to conceive. So that is one kind of people which we see. The second kind of people which we see is, they feel that people having irregular periods, once my period gets normalized, they say that they can conceive. But they don't know what is the cause for the irregular periods. And mostly what they think is the irregular periods is because of some polycystic ovaries.
Exactly.
But there are also other causes by which they're having those irregular periods. So we try to address those issues as well. Then the third kind of people which we see is, they will know everything. That is even more bad, because they will not be able to accept certain things. Once we tell them that you have this kind of a problem, it takes them an immense pressure to accept that they have this problem and then undergo, especially if it comes on the male side. So these are the three type of people which we see in our day-to-day life.
So don't get stressed. I think the video is paused. No. Is it still live? Yeah. Sorry for the disruption. So as ma'am told, don't get stressed, don't make your doctor stressed. Go with a very open mind. You are going there for a solution, not to prove that you are right or wrong. And we are all there to help you. So, that were those three kind of personalities. I think...
also be seeing in your
yes, ma'am. So, what should the couple expect when they first visit you? So, what you are going to do when they first come to your clinic?
First, what I prefer doing is, first I like to talk to them. First, most of the time, the issue will be, like, everything will be normal, but they will not be having a good sexual contact. So, first I try to address their issue. Then I get a detailed history, like what was the past health problems, before marriage, how was her periods, after marriage, how was the periods. So all these in the history detail, whether they have any social habits like alcohol, smoking, especially on the male side. So all these things we try to take a detailed history first. Next, we do a basic examination, like we just put them on a couch and then we just examine her tummy, and then we examine how the mouth of her uterus is. Then we actually insert 2 fingers and we feel how the uterus is, whether there's any pain when I insert my fingers. Then we do a basic ultrasound. an ultrasound it is like a stethoscope for a fertility specialist. So with the ultrasound, most of the problems we'll be able to diagnose. Example, when we just insert the probe inside, we'll be able to see the number of eggs in both the ovaries. We'll see for any cyst is there in any of these ovaries, how was the volume of the ovaries, how was the uterus, any swelling like fibroids, or if it is bulky like adenomyosis, all those things we see. We see for any inside the uterus, any polyp is there, all those things we'll be able to see in an ultrasound. So we do that, and then based on her history and her examination, we suggest certain basic investigations.
Okay. So which day of the cycle you would like them to come, ma'am?
Yeah, so mostly we ask them to come on the second day or the third day of her periods, because that is when her body is not with hormones. You know, the body flushes out all the basic hormones. So we'll be able to see how exactly without hormones her ovaries and uterus is. And we can also suggest certain blood tests also on her second day or the third day of her periods. And we can actually start the follicular tracking from that day on. So we prefer to see them on the second day or the third day of the periods.
So mind it, whenever you go and see your doctor, preferably go on the second or third day of your periods. What do you think infertility is on a rise? We being the most populous country in the world, but I still see, being in a general practice, every day at least 1/5 of my practice is related to infertility. What could be the cause, ma'am?
So, 10 years back, infertility was not on the rise, either because it was not aware that it was on the rise, or we didn't have all these social medias and all those things giving them more knowledge about this. So now the fertility is on the rise because first they try to get married very late, because the profession comes first, the career comes first. So the age of marriage, which was initially around 25, 24, now it has shifted to around 30, 32 years. Only at 35 years, they think about planning the pregnancy. So the advanced age is one of the factors why infertility is on the rise. The second thing, as your dietitian Anupriya was talking about, the diet. The diet plays a major role in causing this infertility problem because of their workplace and because of their fast moving lifestyle. We can see a lot of people with all hazardous food,
Exactly,
junk foods,
exactly.
and not proper lifestyle, no proper exercise, not proper giving family time. So most of the time on the mobile and all
Yes,
those things.
definitely.
So this is the second cause, the lifestyle being a second cause for this fertility problem. The third problem which we are also seeing is, initially we thought infertility means mostly it is on the female side. But nowadays, it is 50% on the male side, it is 50% on the female side. It is not that females are the root cause for this infertility problem. Males are also equally coming to that level, again because of all these factors which I had told. The fourth will be because of the social habits like alcohol, smoking, and all those things can also cause this infertility issues. So these are also coming in Tier B cities like Coimbatore. We are equally seeing that which we were seeing in the metro cities also. That is why we are actually seeing a rise in the fertility problems.
Yeah. So as ma'am rightly told, lifestyle is all what you need to manage. என் அம்மா காலத்துலலாம் இதெல்லாம் ஒன்றும் இல்லை, இப்போல்லாம் இன்னும் புதுசாக வருதுன்னு சொல்லக்கூடாது. புதுசாக வருதுன்னா even just about the male factor infertility, do you have any tips how to avoid this rise in male factor infertility? What should they do?
So male factor infertility cause is around 50%. So the major causes which we are seeing can be divided into 3 types. Either is because there is sperms are very less, or there is no sperms. The sperms being less can again be 2 different types. How less the sperms are. The normal semen count will be around, say, around 15 million per ml. We can also see around 10 to 15 million. So that is okay. It is a count is less, but it is not very severe. So these are usually attributed because of the heat in the body. So for that again we will get back again to the lifestyles and because of the bad lifestyle and social habits, which is the major cause. Stress is again major cause. Body heat is again major cause. For some people we are also seeing wherein there is no sperms at all. We say azoospermia. Now this azoospermia can be of 2 types. Either because the testis production from the sperm production from the testis itself is absent, or there is a block in the tube from which the sperms are going to come. So these two should be differentiated by doing some blood test, by doing an examination by the urologist or the male doctor, and by doing a basic ultrasound scan, which will help to differentiate between these two. So this can also be why, because in their childhood the testes must not have come back to the scrotum. It is called undescended testes, where the testes will be there in the abdomen itself. They are addressing that issue very late in their life, because of which the testes must have shrunken. The second thing can be because of some infections. There can be the blockage in the tube through which the sperms are actually coming out. A simple urinary infection itself can actually cause this problem. So these are major causes by which the sperms is actually coming down. The third, very rare, will be some chromosomal problems, wherein you can actually see the signals coming from the brain to the testes is getting interrupted. So because of that also, they can have poor sperm production.
Okay. So you mean to say, if we diagnose it at the right time, it is still a treatable cause?
Yes,
okay.
Definitely.
So please don't hesitate and see your andrologist or your infant specialist or a gynecologist and seek help. So we have spoken so much about male infertility. What are the causes of infertility as such?
So the infertility as such can be divided like, the first thing will be on the female side. First is hormonal related problems. For example, will be the most common thing which we see in our day-to-day life, which are polycystic ovarian syndrome, wherein there is a hormonal imbalance, because of which we actually see the ovaries being a polycystic in appearance, and we label them as polycystic ovaries. This attributing factor is majorly because of obesity and the lifestyle. The second cause for this will be something related to the uterus. For example, they can have some swelling in the uterus, which is called as a fibroid, or they can have some growth inside the uterus, which is called as a polyp. So this is the second cause. The third cause, the main important thing, there can be some block in the tubes, which can be because of some infection. For example, tuberculosis or any genital infection can be the root cause for this problem. The fourth thing can be there being swelling in the tubes, which we actually call it as a hydrosalpinx. So that will all prevent the sperm from egg to meet and form into a healthy embryo, which can also be attributed to some infections. So these are all the anatomical causes for a female infertility. Now coming to the male infertility, which we already discussed, either the signal coming from the brain to the testes is lost, so because of some chromosomal problems, so that's one type. The second type can be the testis getting shrunken, going in for a testicular failure, or the third thing can be some obstruction for the sperm to come out, which is called as obstructive azoospermia. So this is on the male side. There is also a third entity which is called as an unexplained infertility, which will cause around 25% of the causes. Which around 4 patients we see, 1 patient will definitely have an unexplained cause, wherein all investigations will be normal, but still will not be able to come to a conclusion of why exactly this patient is not able to conceive. So this is the third cause. And the fourth cause can be a genetic problem on the female side as well as on the male side.
So yeah, as ma'am told, 25% of the people we will not know the cause. Here there is a point of difference also. As a general gynecologist, sometimes patients come with unexplained infertility. We have done everything. Ma'am has also seen the patient, and then they come back. Now what? I just tell them 6 months, just don't think about it. And most of them conceive.
Yes.
Does it happen to you also?
Yes. Sometimes people, will be doing one treatment. Then we give them a break for 3 months. They will not conceive when we are giving a treatment. But when they're taking their break, they conceive and come. That's because the stress is not there for them.
The stress, that anticipation, the steroid levels go down, and that works wonders. So please don't get stressed. Don't think infertility is a taboo. Now coming to a very important question. Most of the patients, I feel, they stop the treatment in between because it's a long process. They compare this treatment to a normal treatment. Like if you have cough and cold, you see a doctor for 5 days, you get the medications, next you change, and then you get cured in 5 days. So in 5 days you see the doctor 5 times and you're cured. Now in this in case of infertility, if you want to see a doctor 5 days, it might take you 5 months, because your process of treatment is like that. So, how do you explain the patients not to stop in between, continue the treatment with full heart, and do not compare it with other things? So, what do you want to tell them?
So the first thing which we have to educate these people will be what is, as we started rightly, how will the normal fertilization happens. So I think we need to give them a more knowledge about what is exactly an infertility, how an infertility has to be addressed, how it goes, what is the success rate of each and every treatment, and based on that only we have to start the treatment itself. See, we cannot tell them that if we do a treatment, even if we do an IVF, we cannot tell them it is a 100% successful treatment. Sometimes when we are doing a fertility treatment only, we will be coming to know certain problems based on the level of treatment they are going to acquire. So each and every treatment has got its own duration. For example, when we do an IUI, sometimes the patients with one cycle, there is a 10 to 15% chance of having an pregnancy. But for some, they need at least 2, 3 or maximum 4 to 5 cycles of IUI to have a conception. Coming to an IVF, some people will conceive in their first month itself, but some of them, because of their body, they might take even 3 months to have a conception. So we need to educate them about the duration of the treatment, and importantly, we have to tell them to stay calm and patient for them to conceive before we start any treatment.
Exactly. So, please understand, this treatment is very different from a regular treatment, and you need to have a lot of patience and less of stress to go through it. And now coming to the treatment part, ma'am, there are very many confusions regarding it. So the basic thing which we start from is follicular study. So what is follicular study? How patient is supposed to come? How many times they need to come?
So a follicular study is something like from the second day of her periods. Like today she's getting her periods, that's day 1. So from the second day or the third day, we do a basic scan, and either we put her some medicines for her egg to grow, or we just do how her follicle is developing. So we keep a track. So first scan will be on the second day, the next scan will be around the 12th day or the 14th day directly. Okay. So maximum it will be 1 or 2 or 3 scans. But for certain people like PCOS, when we give medications, they might need additional 2 to 3 scans, because the follicle growth has to be kept monitored. Because if you don't monitor them, sometimes there will be no follicle growth at all, or sometimes many follicles will also start to develop. So only those kind of people will need more scans, but on an average it needs around only 2 to 3 scans for completing one follicular study.
Okay, so you need to complete your follicular study. It will give you so many answers, whether you're forming a follicle or not, whether it's forming properly or not. And sometimes as simple as that, patients ask, the egg was formed properly, முட்டை வளர்ச்சியும் நல்லா இருந்துச்சு, முட்டை கரெக்ட் டைமுக்கு வெளியே வந்து, அப்போ ஏன் ப்ரெக்னென்சி ஆகலை? So A plus B is not equal to C in medicine. There are lots of variables, and you have to keep on trying. So the next question which our patients have asked is, what is tube test? People have seen so many wrong YouTube videos, so many exaggerated YouTube videos, and nowadays when I go for a SSG or an HSG, patient's pulse will be 120, 110. They are so scared, you just can't tell them, please calm down, it's not a painful procedure, I don't know, please help.
So the tube testing is a very mandatory testing for evaluating an infertile couple, because without seeing whether the tube is normal or not, we cannot suggest them to try naturally or do an IUI. So this tube testing can be done by 3 means. For one is HSG, which is called as a hysterosalpingogram, wherein we actually inject a dye inside the mouth of the uterus, and we see whether the dye is flowing out through the tubes, and it is spilling from the tubes by means of an X-ray. So that is called as an HSG. Second is called SSG, which is called sonosalpingogram, wherein by doing a scan at the same time injecting the fluid or a medicine into her mouth of the uterus and seeing the spill by means of an ultrasound guidance. So that is the second thing. So these 2 tests are not 100% confirmatory. For example, if there is no block, just 100% there is no block. But if there is a block, that doesn't mean that 100% there is a block. So always what we do is, when there is a block in these two type of tests, we see whether one tube is blocked or both the tubes are blocked. If only one tube is blocked, it is more than enough for them to try naturally, because one tube is more than enough for them to have a natural conception. But if both the tubes are blocked, the third thing will be a laparoscopy, wherein we actually insert a camera into the tummy, and then under anesthesia we see whether both the tubes are open, or if there is a block also. Based on the level at which it is blocked, we try to rectify the block also. These tests, when we actually tell them, most of the time they are actually getting very scared. But what I would recommend is, when they are going to have a pregnancy and when they are going to have a normal delivery, that pain is nothing equivalent to all the pain which they are experiencing right now. So whatever the social media has been projecting, I don't think so it is that much a painful procedure to do, because without doing that, we cannot suggest any correct treatment for you.
Yeah, and no pains, no gains, they say.
Yeah.
So yeah, okay, if it is painful also, we do cover our patients with some painkillers. So please feel free. If you need a tube test, you need to do it. And the only option, as ma'am told, was laparoscopy. But then it's a bigger affair. But then at some point of time, we do suggest laparoscopy to the patients. So what is the category where you recommend laparoscopy for the patients? Do all the patients in infertility need it? And what next after?
So laparoscopy, as you rightly said, the affair is little bigger than for a basic investigation which we do it routinely. But for certain people, the laparoscopy comes first. Mainly in patients where, when we do a tube testing, when both the side of the tubes are getting blocked, there is no other way to rule it out other than doing a laparoscopy. The second thing is unexplained category, wherein with this basic scan and blood test, which we are not able to find out the root cause for the infertility. So for unexplained category also, when we had tried around 1 to 2 cycles of an IUI, but still we are not coming to a cause why she is not able to conceive. Sometimes when we do a basic or laparoscopy, we have even seen many of the people conceiving the next cycle or the next cycle itself. So I feel doing a laparoscopy, rather than being a diagnostic test, it will also help in having a successful pregnancy also. Okay. But sometimes when we do a scan and we are seeing a fibroid, based on the size of the fibroid or any polyp, or based on the size of the polyp, the location of the fibroid, we suggest a laparoscopy. So it can be a diagnostic method also, as well as it can be a treatment method also.
So as ma'am told, sometimes in laparoscopy we do find out the cause of infertility, like fibroids, like endometriosis, adenomyosis, and we treat it on table. So it is both diagnostic and therapeutic. So if your doctor has told you to go for a diagnostic history lab, please go ahead and get it done. As ma'am told, you might have a successful pregnancy soon after that.
Yes.
Now talking little more about endometriosis. Endometriosis and infertility, where do we stand?
Endometriosis is now on the rise.
Yes.
Initially, we didn't see so many cases of endometriosis, but of late, especially in the last 10 years, we are seeing more endometriosis patients. Simply, we should have just put a laparoscopy just to find out what is the cause for her infertility, and we can see some spots in her ovaries.
Yes.
So it is becoming very prevalent. Now this endometriosis, the problem with that is, it is something wherein we will actually see that the uterine tissue is outside the uterus. It grows around the uterus, close to the tubes, close to the ovaries. So because of that, what happens is, we actually see patients wherein they have severe painful periods. But their pain will be so bad that definitely they need some injectable painkillers to relieve the pain. We have even seen patients before their marriage itself experiencing this kind of problem, coming with all 6 centimeter cysts, 7 centimeter cysts. So this endometriosis awareness is very much needed, because most of the time they think when there is an abdominal pain, they go to a hospital, they get diagnosed in a different way, but most of the time it will be the endometriosis which they were not ruling out, and that will not be addressed at the right time. Because the endometriosis in the early stage can be handled with set of medications.
Yes.
Only in an advanced stage we need a laparoscopy. So definitely, especially a female, even before marriage, if they are having this kind of a severe pain during the periods, please meet a gynecologist, rule out what is the cause, and then plan the pregnancy. And secondly, the endometriosis is now coming on the top of the list for infertility because the sequelae because of the endometriosis, like there will be because of the cyst releasing certain type of fluid, we can actually see that everything will be frozen inside, all the uterus tubes, everything will be like a cocoon it will be.
Yes.
So the anatomy itself will be gone. Now sperm and egg will have its difficulty to go and join together and form an embryo. The second thing is endometriosis in the ovary is definitely going to affect the quality of the egg. Quality means sometimes we will actually see that the follicle is developing. That means in patient's language, the egg is developing well. But we will not be sure whether the egg is getting released, how is the quality of the eggs, whether it is matured enough to go and form into a healthy baby. So all these things get impaired in an endometriosis. Definitely an ovary with a chocolate cyst and ovary without a chocolate cyst. The without a chocolate cyst has got a 25% more chance of conceiving than with a chocolate cyst.
Okay, so that's one take-home message from ma'am. If it is endometriosis, if you have severe dysmenorrhea, closing your eyes towards a problem does not mean it will give a solution by itself. Please do address it and get a solution for it before it goes to the next stage. So usually patients think all the hormones which we give during this treatment have major side effects, and the moment you tell them you might need some hormones, their first question is no, you will give me hormones, I will put on weight, otherwise I will develop cancer, and that's it, there goes the treatment. So what's your take on it?
Actually, there are various studies which have proved that treating within hormones is not going to trigger a cancer, especially an ovarian cancer. The incidence is very, 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 very less. But yes, it should not be exploited right and left. The person should not be given hormones.
Exactly.
Because only when it is needed, you use it. Otherwise, don't use it. The problem is more what happens is we will stimulate a patient with the hormones. But what they will do is that cycle they will not try.
Exactly.
They will just skip that cycle, and then the next cycle they'll come and stand telling why am I not able to conceive. So I always tell the patient, if you are in a better position where you can try, where you can have you will be able to definitely have a good sexual intercourse, then you start using the hormones. Otherwise, don't use hormones. So this is one type. The second type is, as you were saying, whether hormones will cause increase in weight. Definitely the answer is no, because these hormones are given in a very, very small dose. It's a very, very minute dose. This dose will not definitely increase the weight. Mostly what happens is when the patient is taking this kind of tablets, subconsciously they think that they have a problem, they get stressed. Because of that only there is a lot of weight gain. The second thing is, they will not move. Once they start the treatment, they will not have any physical activity. Once they get ovulated, they feel that the baby has got stuck inside the uterus, so they will not even go for a walk, nothing, no physical activity. That is also the second reason why there is an increase in the weight gain. So these are the most kind of reasons why I will tell my patients the cause for the weight gain rather than because of the drug itself.
Yeah. So what ma'am rightly said, medicines will not cause this issue. The issue is totally different. It's more from here than from the medications. Yeah. So coming straight to the point, in nowadays world, everyone wants 100% guarantee. What is the success rate of different infertility treatment?
What we are not actually, what I tell my patient is, I can only give you a practical point of success rate. Exactly. I cannot tell you that 100% any treatment can work out. We have to give our 100% to make that work out, but I cannot tell that by doing this treatment, even if I'm going to do an IVF, you're going to have a 100% success. So patient must understand the practicality about it, explaining to them why the success rate is only so much. So when you come to the individual treatment, a natural conception success rate is around 20%. That's it. Yes. So with this, we are adding a 10 to 15% of extra success rate by doing an IUI. So generally IUI, they say when they do it consecutively, 1, 2, 3 cycles, the success rate will keep on increasing by 5 to 10%. So that's about the IUI. The third, coming to an IVF, the worldwide success rate for an IVF is only 30 to 40%. At the maximum, we'll be able to attain around 50%. So for that 50%, we need to put our 100% to make it successful.
Exactly. So the statistics are very clear. 20% we are the most populous country in the world. Definitely 50% adds the cream to your success rates. So nothing can be 100% in medicine, and going for a success rate of, I think, no, as far as my experience with Nova infertility is, to be very true, I have a very good success rate with you. So for me, it is, I tell my patients, statistically speaking, it's 30 to 40%. But what I have experienced personally, my own clinic study, it's almost touched 80 to 90%. God's grace. So now another very sensitive question. Lot of patients do doctor hopping. I feel it's like starting the ABCD again and again. You reach till Z and then come back and start ABCD again. How to stop it? How to make them understand? And does it really help, doctor hopping?
See, I will tell you that the cause is on the doctor's side as well as on the patient's side.
Exactly.
I am not telling that only the patient is to be blamed for that.
Yes.
So what happens is, what I feel is, when a patient comes, when the patient is being explained about what all the information we have, that itself will have the trust on us. This is only we can do. We are not God to change everything in overnight. We can also take only step by step, and then we can try to reach whatever the goal we need. So that we need to make them understand. That step itself will help the patient to develop the trust on us.
Yes.
The second thing is, the patient has to trust themselves. They should trust that whatever they are doing, it's being done only for their good thing, the goodwill, and unnecessarily they're wasting their time, because they will be reaching almost close to the pregnancy, but suddenly they will change the doctor. When they change doctor, again they go right from the first, and again it goes. So that will put them into a lot of frustration and stress that will prevent them from conceiving. So I always will tell the patients, stick to the doctor. Like when patients are getting referred from one more doctor to me, I put the patient back to their doctor itself until I need to be intervened. Okay. Until then, I feel that doing a basic follicular study, doing a basic investigations, then all the tests which I told you, all can be done even in a small clinic.
Yes, exactly. So, ma'am is very right about it. Taking a second opinion, no harm. You can go ahead and take it. Every doctor has its own way of working, and when they are not able to treat you beyond a point, they will tell you. And ma'am is always there. So, now coming to the treatment options, can you throw some light on what is IUI? People always tell IUI is equal to IVF.
Yes.
So, what is IUI and what is IVF?
So, IUI is nothing but intrauterine insemination. So, generally it has been done for people where around 3 to 4 years, especially the unexplained type of people where no cause is being found. So, for those patients, we suggest an IUI as a first step in their treatment. The second, when the movement of the sperm is very less, like the sperm motility is less than 10% and the sperm is not able to reach the tube, so those kind of people we suggest an IUI. Third, most importantly, when they are not able to have a sexual contact. For some male side, they will have some problem in the erection, or they will not be able to penetrate and ejaculate it completely. Third, or the patient will have some severe pain during the time of penetration, or it can also be psychological. So those kind of patient, IUI will be helpful. The fourth is when there is no sperms and we have to go in for an alternate sperms, where we use a donor sperms. So for those kind of people also, IUI will be helpful. But IUI is almost similar to a natural conception. All we are just doing is processing the sperm, putting the sperm close to the tubes. We are taking the sperm like a car. In a car, we are just putting it close to its destination so that it can go and do its work.
Bypassing.
Yes.
That's all.
But after that, whatever happens in a natural way. Forming an embryo going and implanting, everything happens in a natural way. So that is called as an IUI. This will not need more of injections. Maximum, very rarely we give around 2 to 3 injections. Most of the time with tablets itself we will be able to give a success rate. Now the second category of patient is IVF, which is called in vitro fertilization. This is being suggested wherein we are not able to find out any cause and we have tried all the treatment and nothing is going to work. So for those kind of patients with multiple IUI failures, IVF is being done. The second category of patient is when there is a tubal block, wherein we cannot try a natural method. Whatever happens in the tube has to be done outside. That is only called test tube baby. That's called IVF. So that's the second thing. The third thing will be, as we discussed, a female cause for an infertility, like this chocolate cyst, especially when a severe type and there's lot of everything has been frozen like a cocoon where natural conception will not happen. Those are the kind of patients IVF will be helpful. IVF is nothing but we actually give them certain medications, like injections will be given on daily basis, and then we try for a natural or an IUI we try to focus around 2 eggs, but for an IVF we try to focus at least around 6 to 8 eggs to grow. It will be done, there is no for any need for any bed rest or any admissions at all. We try to follow with the follicular tracking, we try to develop the eggs, we take the eggs under anesthesia. That cycle which the eggs are getting produced only is being taken out. The next cycle again she is going to have a good number of eggs. So that eggs we take, we keep that in a dish, we just put the sperms and the sperm will go and reach the egg and form into an embryo. Then the next category is called ICSI or the ICSI, which is called intracytoplasmic sperm injection. This is mainly done when there is a problem on the sperm side, especially when the motility is less, when the look of the sperm is not very good, or when the sperm count is really very less. The same process of IVF continues, but instead of just putting the sperms close to the egg, we inject the sperms into each and every egg, and then we form the embryos, and then we transfer the embryos. So these are the
types of this. So IVF itself is a very broad term. Nariya type, the test tube baby nariya types irukku. Okay, so a doctor is going to decide which suits you best. So here one point of caution: there are so many lucrative schemes coming up. 75,000 package, 1 lakh package. Why is IVF so costly, ma'am?
So the cost of IVF goes with 50% on the drug side, because we are going to use certain hormone injections, but there are Indian version of it, which will cost not very costly about it. So that is one reason, and they have to take a daily injection. One injection will be for the growth, one injection for the follicle not getting ruptured till we take out the eggs, and the third injection is for the maturity of the eggs. So this is one reason. The second reason is for the procedure related, because we are taking the patient into the theatre, we have to give them the anesthesia. So for all those things we are using certain consumables, which for that the cost goes. And the third thing, we are growing the baby outside the uterus. So that needs a good setup. We need a lot of media for it. We have to mimic whatever happens inside her tubes and the uterus to happen outside. So it's only because of that the cost is actually high.
So go for the quality, because these things you do only once or twice in life. Wherever you feel if the treatment is best, go there. Sometimes you should think above money. So IVF should be done in a very good center. We have discussed about IVF. What is it? Different types of IVF also. Now there is something very, it will be more of an educative thing for our patients. Egg freezing and sperm freezing. Egg freezing is very much in fashion with so many actresses coming up with it. Yeah. So what is egg freezing? Is it recommended, and who should do it?
Yeah. So this gamete freezing, the sperm and egg freezing, actually started only with cancer patients. It was first started by those who are taking the treatment for cancers, especially in their young age before marriage, wherein they will be taking certain drugs or radiation which will definitely affect the sperm and the eggs. So the cancer doctor usually tells them to go and freeze their gametes before we start with the treatment. That's how this freezing option started. Second, it came to a thing where we do an IVF, we have a lot of embryos, we cannot transfer all the embryos inside the uterus, we transfer 2 embryos, the rest of the embryos we freeze and keep. So that was the next step in the freezing. But now we have moved to the third step, because most of us are into career-oriented professionals, wherein we started the discussion with the age group, they want to plan the pregnancy later in their life. But at that time, definitely the quality of the egg, the number of eggs, the number of sperms, everything comes down. In addition to that, a lot of genetic problem also starts coming. That is why people started thinking about doing this egg freezing and the sperm freezing. I will not tell that is a boon for those in a professional career, but at least they can take that as an option, but that should not be the option for them, because definitely, though I can freeze the egg and sperm at a younger age, but their pregnancy in their advanced stage is definitely complicated. You will be knowing about it. After 35 years, going through that pregnancy is not only stress for the patient, it is also stress for the doctors also. So definitely I will not motivate people to do that. But some people who cannot focus right now on the family side because of their problem with money, etc., they can take this option of freezing the eggs, or if they are married, freezing the embryo. It can be kept frozen at least for 10 years. It's been improved. Great. So then whenever that they feel that the right time to transfer their gametes, they can come back and just take the embryo, or when they come married, we just take the sperm, inject into the frozen egg, form the baby, and then transfer the embryo inside the.
Do we have this facility at our center, ma'am?
Yes, we do. We see many people coming for this problem also. We are seeing more of these cancer patients coming to us. But nowadays, we are even seeing in Coimbatore, we are seeing patients who are coming for this social freezing also.
Yeah, even to me, so many patients have come, approached. But then I think there are a lot of legalities also attached to it, and it's better to send to the specialist. So if you guys or any of your friends have any plans of egg freezing, first of all, we would discourage it, and if you want to go ahead and do it, go and get it done in a specialized center. And people have this notion that embryo freezing, when you will, the quality of embryo won't be nice. So is it true, or
initially when embryo freezing was started, there was two types of methods for freezing. It's called slow freezing method. So those type of freezing was actually affecting the embryo quality. So that way we usually transfer at the same center. Now technology has advanced. More than the technology, I feel the lab plays a major role in withstanding the quality of the embryo. So now we are going to do another method that's called as a vitrification technique, wherein when we actually freeze the embryo, definitely the quality is not getting compromised. We freeze embryo only which is of top quality, because the less quality embryos, when if it is kept frozen, definitely it's going to affect the quality once we defreeze the embryo. Only the top quality embryos we take it for freezing. So once we freeze, definitely that is not going to have an impact on the quality. In fact, we have a lot of studies showing a frozen embryo transfer has got a much better success rate than a fresh embryo transfer. Mainly because in a fresh embryo transfer, the female will undergo all the procedure of egg retrieval, anesthesia, everything, and in 5 days again the embryo is put back. So sometimes they won't feel it very their ovaries will be swollen once they've done a retrieval, so they don't feel comfortable about it, and they want to freeze the embryos and then transfer. When we transfer the embryo, we just give them hormone tablets, prepare the uterus, and then put the embryo back into the uterus. So the frozen embryo has got a much better success, and embryos can be kept frozen at least for 10 years.
That is great news for so many people out there. I know you have so many questions. People are keeping on joining, asking questions, sending us message. But for the want of time, we have to stop this session now. But you all are welcome to send your queries to us. We will put it right away to Dr. Meenakshi. I am there. Dr. Meenakshi is there to settle all your queries. Ma'am is always available at Nova IVF. If you are not able to reach ma'am, reach me. We will sort it out for you. Thank you so much for joining us, and thank you so much, ma'am. These questions were long-awaited questions, and thank you for your time and joining us on a live session.
Thank you for giving me an opportunity to give an awareness to all your people.
Yeah, welcome, ma'am. Thank you so much. See you then. Bye.